Thank you. The next question, the member for London West.
Thank you very much, Speaker. My question is to the Premier. Speaker, Barbara Savage is 84 years old and lives in London West. She recently received a sudden and shocking diagnosis of stage 4 breast cancer and underwent a double mastectomy in February. With tubes dangling everywhere from her chest, she was discharged and told a nurse would come to her home the next day. Speaker, 11 days later, a nurse finally came. When the tubes filled with blood, Barbara's daughter had to Google how to drain them herself. Speaker, does the Premier believe that this is an acceptable standard of home care?
Parliamentary Assistant to the Minister of Health.
Thank you very much, Mr. Speaker, and thank you to the member opposite for the question. No, I mean, this is an unacceptable situation. This should not have happened, and I feel very badly for that person who waited 11 days for someone to come and see them. Our government has made significant investments into home care. A strong home and community care sector is critical to our government's plan to end hallway health care and build a patient-centred, connected system. And that's why a few years ago, I think last year, we invested in additional $1 billion to improve the quality of care and keep people of Ontario in their homes longer with the care that they need. And we like the model at the South Lake Hospital, South Lake at Home, which has the home care provider meeting with the person who's going to receive the care in the hospital so they can meet the doctor, the nurse, get the discharge papers, and so that person will know that the person will be there and when. And so we want to make sure that that's the kind of system we have across Ontario so people get home care, which is appropriate, and can stay out of hospital and get well.
The supplementary question.
Speaker, Barbara Savage's case is not unique. The revolving door of staff in private, for-profit home care agencies has left patients like Barbara on their own. When Barbara and her daughter frantically called ParaMed, they were told no nurses were available. Thankfully, Barbara did not develop complications, but many patients do, forcing them back into the hospital. Speaker, will this government admit that its failure to address the home care worker shortage, its refusal to drop the unconstitutional Bill 124, is putting the health of Ontarians like Barbara at risk?
Parliamentary Assistant to the Minister of Health.
Thank you very much, Mr. Speaker, and thank you again to the member opposite. As this government has said many times, the only thing better than care close to home is care at home. And in partnership with hospitals, primary care, and on our Ontario health teams, Ontario is expanding and improving access to home and community care. Through the 2022 budget, the government announced the plan to invest $1 billion over 3 years to get more people connected to care in the comfort of their own home. But our government is now, through this budget, accelerating investments to bring funding in 23-24 up to $569 million, including nearly $300 million to support contract rate increases to stabilize the home and community care workforce. This funding will also expand home care services and improve the quality of care, making it easier and faster for people to connect to care. Having strong home and community care for people like Barbara is a key part of this government's plan for connected and convenient care.